When you look at Tulsa County, it's actually the 18th highest in the United States for the number of people dying from prescription drug overdose deaths.
The statistic caught Mayor Bartlett's attention when he heard Terry White, Commissioner for the Oklahoma Department of Mental Health and Substance Abuse Services, speak at the Capitol. The topic was pervasive prescription drug abuse and what needs to be done to address it. Mayor Bartlett discussed the problem with Tulsa Police Chief Chuck Jordan as a mental health issue and a prelude to criminal activity. They made a commitment to do something to reverse trends that made Oklahoma one of the top 5 states with the highest prescription rate for hydrocodone, oxycodone, and other powerful painkillers. Prescriptions of these painkillers outnumber citizens at 128 to 100.
When I first heard the seriousness of this problem in our city, in our county, it really stunned me. Tulsa County, unfortunately, is #1 in the state of Oklahoma for deaths, number of deaths due to prescription drug overdosing. It's a community problem, it's a societal problem.
It's something we can no longer ignore. It's not going to be something that's fixed in a day, a month.
They run behind him, but they've got penetration.
Our son, Austin, died of a prescription drug overdose in 2011. He was a linebacker on the University of Oklahoma's football team. He was a remarkable young man who had so much to give.
We lost over 100 Tulsans, for prescription drug overdose death in the last year.
Mayor Bartlett gathered together business leaders, healthcare providers, law enforcement officials, parents, and school counselors to discuss solutions. It was the first in a series of public safety summits, the goal of creating community-wide plans to address issues that break communities and families from prescription drug abuse to domestic violence. The summit plan resulted in new awareness and action steps to reduce the number of drug-related overdose deaths, prevent abuse and diversion, and better assist those seeking to end their addiction to prescription drugs.
We can make a difference, especially with the leadership of community leaders like the mayor, our police chief, our schools, our businesses, all coming together.
Everyday people who are abusing prescription drugs, and they're the people next door, they're the people you'd never suspect. They unfortunately might be family members.
To parents, be vigilant. Don't be afraid to ask questions. Even if you think it's a hard question, ask it.
It's kind of under the current, it's kind of hidden. You don't see the prescription drug abuse like you do the illegal drug abuse, because these folks, most of them aren't committing crimes. It's just incumbent upon our community, law enforcement, everybody, to do anything we can do to try to stop prescription drug abuse.
The summit partners took a first step in developing strategies for educating families, schools, and youth. They recommended more work to provide additional counseling resources and information for physicians, pharmacists, workplace educators, and schools to safeguard our community members from inappropriate and sometimes dangerous use of prescribed narcotics. Painkillers are essential for temporary and chronic conditions to manage pain, but their addictive power can be a hidden danger to the patient, turning that person into a potential threat to themselves and to others.
We do know we're having a lot of robberies in Tulsa, and they're always going after hydrocodone, oxycodone, the very painkillers that people are overdosing from. So we know it is a big problem. We're doing everything we can do from the law enforcement perspective, but I think there's an important component of education, important component of prescribing that we also have to address.
This is one Tulsa. Whatever affects any part of our town affects the entirety of our community. Let's look out for one another. Let's look at our families. Let's look at our circle of friends. And if we see a problem, let's deal with it.
We have got to store our prescription drugs appropriately. We've got to dispose of them appropriately.
If we can get information out there, we can prevent people from becoming addicted, and we can prevent overdose death.